Meera, is it okay if we start?
Yeah, let's start.
Okay, so I'll start with sharing my screen. So, welcome everyone. Thank you so much for being here on a weekday evening. We are hoping to take 2 weekends off for Ganpati. We are hoping to take 2 weekends off for Ganpati. So, I suggested that we start today. And thank you for being here after your work on a weekday. So, today we are on the, one second. We are on the 6th of the case discussion series, and Meera has so kindly accepted to be the speaker for today. Um, so, Meera is a MSLP, holds her MSLP from AYG Mumbai. She has additionally done her postgraduate diploma in counseling from Heart to Heart Institute, Mumbai. He is a private practitioner since 2013 and is the owner founder of Intune speech hearing and counseling services at Ghatkopar. And she has been previously associated with various hospitals in Vikhroli and Ghatkopar. So, welcome, Meera. Thank you for supporting this. Hopefully, we all learn from each other. The whole purpose of doing this is that. So, I'll stop sharing. So go ahead, please go ahead.
Yes, thank you, Debo, for this initiative. It really, gives us opportunity to know each other's perspectives. And as you very rightly say, it just adds to our ears and we learn
Yes.
from each other. I think that line is perfect.
We don't need to make all the mistakes ourselves, right? There are people who are discussing this, discussing issues. So that is one great thing. And as private clinicians, we do have a lot of issues, right? That we never learn about. We only experience it and then we are like, okay.
And even for that matter, certain things that we know of, sometimes when we hear it from others, perspective, it's like a
Correct.
reminder, knock, knock. Sometimes you miss
Yes,
things. So
correct.
it's a very good initiative. And thank you for giving me this opportunity.
I'm very eager to hear from you. So please go ahead to share
Chalo,
your
let's
screen.
start.
Yes,
Let's
yes,
start.
please.
Let me know once you see my screen.
I can see your screen. I think you need to go to the PPT, the presentation mode, the slideshow mode. I'm sorry.
Yeah.
Yes,
Now,
yes, yes, totally.
so yes, today we are discussing about this girl, RS. So she came last February. At that time, she was 3.5 years. She was there with her mother and the brother. So mother, let me just give you some history about it. Mother is a practicing dentist. She has her own clinic and she also has her dental recruitment agency. So, and two kids. So she is juggling between so many things. So that's how she is. And brother, around 3 years elder brother, who's very supportive. So they had come together. Their main complaint was that she doesn't speak clearly. And secondly, she said that she speaks at home in her comfort zone, she speaks better. But when she is outside, she is completely mute. So what she calls is that, at selective mutism, that's what she, explained. So knowing about her medical history, she had a foot issue wherein in the womb, the size, the positioning of the foot is such that the child has different length of the legs. So for that, continuous OT was happening since a few years. Behavior, otherwise there was no medical history. Her behavior in the session when she first came, she was very fidgety and she was very restless. Her attention was very poor. Language skills were not age appropriate. So as per Reels, it was around 30 to 33 months RLA and ELA was 20 to 22 months. So when I again come back to behavior fidgety in the sense, whatever material you give, if you give blocks, she'll just drop it one after the other. And, each time she'll look up and see, are you getting irritated out of it? if it is cards, then she'll try to tear it, she'll try to, scratch it and things like that. And restless in the sense, at that point of time in my clinic, I had examination bed, chair, and table. So she had got a nice playground and she was just hopping around between the three places. And throughout, that was the scene. So OPM, frankly, for few sessions, there was no checking about it because there was no sitting in the first place. So after a few sessions, yes, we saw that it requires work. There was strengthening issues were there. Articulation, if we see, so here I put a tick mark, what was there, and I always put a star. That is, we work a little and we gain our stars rather than not having that. That is something we look for. So articulation was, bilabials were very inconsistent. It is there in certain words it is not there. Certain vowel transitions, most of the vowel transitions were not there, even for bilabials. The, and no. Practically, these were the three sounds which she had. Rest, everything was inconsistent. You all can see the entire thing. Yeah. So this was the articulation. Voice, she will either be very, very soft and then she'll have a very, loud burst when, when we say that, try and speak loudly. So that was the case. So let's listen to the recording. Can you hear?
No, we can't hear. Go to the last three dots on your screen more and share computer sound from there. Maybe we can hear it that way.
I think I am on the Bluetooth, which is why. Now?
Yeah, we heard it now.
So this was again with the mother, just with the mother, one word answers are there, or probably repetition of certain things are there. That too after many, many trials.
Girl, you are a girl, but what is your name? What is my name? મમ્મીનું નેમ શું છે? તો તારી મમ્મી છે. મમ્મી ગર્લ છે.
So now here she is trying to get repetition of numbers. Later, I think she is going to try repetition of certain rhymes. So ta is majorly what we can just hear. So mother was of the opinion that she basically was concerned only with the clarity. But then we had a discussion that there's a huge gap between the language age and the chronological age. So, but because the child was speaking better with her, so she was not really concerned much about it. But then, so the child was speaking few sentences. You can see the full screen. Yeah. So here ELA, according to what was seen in the session, was 20 to 22 months. Even with the mother, when I discussed, it was something around like 24 to 27 months. Still a huge gap was there, but it required a little bit of convincing to her that clarity comes later. First, we need to have that language base. If the language base itself is not there, then the clarity is kind of secondary. So work on the language. And also we had to discuss, mainly there was very low compliance, just not there. So anything, because knowing that it is just certain sounds are there and that much of language gap is there, it's going to be a long journey. So we had to put certain things in place. So we had to discuss the ways in which, okay, 1 minute. Ways in which we need to handle things. So the session structure initially was once a week. It was structured, but it had to be very, very flexible. The focus what we had distributed was 80% of language, 20% of speech. The brother was involved in the activities always in the session. Mother was, I usually don't like, parents being outside, but in her case, with the presence of mother, having that comfort zone, she was just not complying. So then mother was sitting outside, brother was always there, very, very helpful. He was, demonstrating everything, and then she used to kind of play along and get along. So, and initially also with her also in few sessions, we kind of made it that you want to hop around the room, it's okay, but let's choose the place and let's choose the activity. Freedom was given to her that, okay, these are the activities, choose which activity you want, and place wise we select, okay, on the bed we'll do this, on the chair we'll do this, on the table we'll do that. So that was done, and in few sessions she kind of understood the structure, and then we were following it. So focus on the goal initially was using verbal utterances. Outside she was majorly into pointing, I want this, I want that, as in just pointing. So verbal utterances, having that use of verbs, what she had was majorly just nouns. Verbs were not there, so verbs was a focus. Using of phrase, I want dash, no I don't want, yes I want this. So started using phrases and increasing the length of utterance. So as an example, it was just initially she would just point. So we moved to knife, then we moved to I want knife, then we moved to knife to cut pizza. And then later on, we added, adjectives and prepositions also. So that was the thing. Activities, what we usually used was, so if it is on the bed, may we make some designs. She chooses the designs, she chooses the materials. So if she wants sticks, plastic sticks, she wants ice cream stick, plain one, colored one, blocks, she wants plastic blocks, wooden blocks. So a freedom was given to her that you choose the place, you choose the activity, but then she has to, within that boundary, she had to focus that each time, unless until you speak, you're not getting it. So that way we started getting more of response from her. Cooking related activities, she was very much interested. So again, kitchen set vagara is one thing, but again, art and craft, drawing pizza, coloring toppings, sandwich making. So we make bread, and you different slice of different vegetables, you draw and cut it out and color it and then put it on the bread, and that way you make your own paper sandwich. So those kind of activities she was very much interested in. So usually that used to be the sitting on the chair activity, and then she would come on the table at the end, and then we would used to have some card kind of activity wherein normal cards, what goes together, sequencing, what's missing, or a pop-up storybook. So I had to kind of make sure to have go from low risk to high risk therapy materials, because throughout tearing and all of that was there. So by the end of the session, she was kind of calm. So then I could, introduce those paper things. Initially, in the initial sessions, I had to kind of bring back all of my old material, which I would be okay even if it is torn and all, because that was the behavior for a long time. Brother was helpful. He was demonstrating, everything, and she would play along for, I would say, 2-3 months. Then successfully, things turned around, and brother from a demonstrating partner became the partner in crime, and he also started having things like joining her with her those kind of behaviors. So we had to kind of rethink, should we have the brother? And then later brother also had a school timings changed and all of that. So we decided now the brother will not be there, she'll be sitting alone in the session. But then the challenge was how to make her engaged. So we realized that sports kind of game kind of things, which had some movement involved in it, that kind of really engaged her. So we always, then later on, we started the session with things like catch catch, or basketball hoop, bowling, ice hockey, table tennis, mini pool, or a pop-up game, dart game, mini carom, things like that. So initially it was just that, which was, it was not used just as a reinforcer, it was very much a part of the session, whatever the language goal was. Yes, in terms of articulation therapy, there it was used like a reinforcer, that you say some and then you get your chance. But it was kind of weaved in such a way that language and articulation and everything had to be kind of going together. I couldn't separate it, because that much of attention span on all of us not there. So in the initial 6 months, as far as articulation was concerned, uh, her were, la were inconsistent. So the simulability and all was very good. So we began with very simple sounds at isolation level. What we realized that her inconsistencies were very inconsistent throughout all the sounds also. So if it is like he is there, not necessarily Lee will be there. Who is there? Lu. So E, U, amongst the different sounds, vowel consistencies were not there. So then what we figured out, instead of initial, medial, and final, what we did was Barakhadi wise, her, ha, he, all those individual words we kind of figured. And we were not even, I was not looking at, trying to work on the vowel transitions which were not there. I was like, let that be. Whatever is there, let's have consistency with that. So a praxic component was there. So I didn't want a big pool of words. We were having very small, 5 to 6 words in each of the sections. And then we went along with that. So that way we had to kind of figure out. There was a significant amount of improvement in her. And she naturally was also during her growth phase. It's working better. Articulation wise also, it's going better. So then we decided from once a week, we now move on to twice weekly sessions. And now it was language 50%. She was getting better in language. And then articulation was 50%. That time, again, her compliance was better. So working on OPM externally and a little bit internally was there. But again, for elevation, she was not allowing. So, but we were doing more of vela stimulation, so that once we reach the vela sounds, at least those get started. So now the language, after 6 months, the language was focusing more on, using of understanding and expressive of adjectives and overall narrative skills. For articulations, bilabels was a tough one for her. If in the recording only somewhere she said Baba correctly, but boy was not there. So, bilabels itself was 40% bilabels were there, but 60% mostly it were not there. So anything you do, close the upper lip, lower lip, anything, nothing was working. Non-speech wise, she could hold the stick and all, everything was strengthening and all, that was not a problem. But it was just not coming in whichever way I tried. Luckily, one fine day, we were playing some game, Simon Says or something, and then she had a pen, and then let's put the pencil on the paper, and it was all correct. The all three P sounds which were not possible for her, and suddenly it was coming. So we realized, okay, holding it while you are speaking it, that is something that worked for her. Otherwise, she couldn't, in spite of not having that strength issues, because of the praxic component, she couldn't do it. So then we realized, okay, that is working. We went ahead with that. Mother had a suggestion that she had a concern that I wouldn't want to allow her to put things in her mouth, because then immunity also gets there. It's a risk. She puts crayons and everything in her mouth. So then we suggested, okay, it's just when you wash your hands, for those 15 minutes, just let her put her finger and then speak. So she was okay with that. The mother was also okay, and the child was also okay with it. So that's how we got our bilabials. And then for and so we were working on. At that time, earlier sounds at phrase level we were working on. For articulation, we were using activities more of like a ring game. So Mahabaleshwar ka ring game. So you have those things, small things of, say, P sounds, and whichever you select, you throw the ring on it, or a treasure hunt, or a sound bag. So if it is a P sound bag, we have things, coming out from it. So likewise, I had, told her, let's make all the sound bags, And they had some 500 plus flashcards at the house. So in the house, segregating the flashcards and things like that, they used to do. The things were working fine. So, but then again, school timings after again another 6 months. So around after a year or so, school timings were changing and it was getting difficult for her. So we again made it into once week session. Then after that, again, 1 or 2 months went, and then suddenly mother was like, probably I might have to shift. And she herself was very anxious. She was like, I want to shift to some interiors. There was some internal family issue. But she's like, I want to take the decision based on my child, like my kids, both my kids' development should not be affected. So I take the decision of moving out only if my kids are not getting affected. So I could see that how apprehensive she was, but at the same time things were not working back there, so she had to take a call. So just telling her that it's okay, we have SLPs all around, even in the interiors. If you have to take a decision, take it. Do not stop yourself just because of this. Initially we can have online sessions and then you can slowly find someone. So but just giving that assurance, immediately I could see the change. She was so rest assured. But thankfully things were stabilized back there in the house. And once a week sessions again were continued. Thankfully again the family involvement was there. Earlier it was just a one-man show. I used to kind of keep telling her, get more of recordings with different family members so that we could analyze and work on things. But she would directly say it's a one-man show, I cannot get it. But now again family involvement was there. Father started coming to drop her, pick her up, some feedback here and there. So things were going very well. And again, now the major focus on language was prepositions, understanding, both comprehension, expression. And then we very smoothly, because earlier she allowed a lot of velar stimulation. So velar sounds were very smooth with her. We could do that very well. So in the meantime, we started working on tongue elevation, preparation for the palatal sounds, which also she did well. That again happened for 2-3 months. And then now suddenly very bad stammer, like I had seen few bits of stammer, but that kind of was spread across in like 2 to 3 months. Once I could feel that, oh, is it developing? Once or twice I had kind of noticed it, but it was just that. But now it was frank, like suddenly one session she comes and 4 to 5 blocks, long silent blocks. It was very much. So then we were thinking what to do. Mother was not really concerned much about it, because with mother, she was again in a very comfort zone. With the mother, it was not coming much. So mother was like, I am not really bothered much about it. I was in fact worried. So I told immediately, let's stop articulation. Let's stop it. Let her be. If you want, we can work. Because again, her growth spurt was happening so well. So she opened up. The mother initially also said that, even non-verbal activities, when she started, she used to freeze around, in any social gatherings. She was just stand there. Anyone around her would make her uncomfortable. But now towards the end, what we have seen a change in her, even non-verbal behavior. She by herself takes an initiative to go in social gatherings. She enjoys with everyone. She had sent those videos that I don't mind even sharing, that she was enjoying everything. So there was a growth spurt. So her need for language was increasing, but probably the speech was not keeping up that much. So that was the thing. So I kind of said, okay, let's stop it for a little while. But the mother said she is so prone to that. Minute she gets some leeway, she will not come back. Same thing had happened with her shoes, the spins, that once or twice we had to remove it and then she just wouldn't wear it again. So she was a little worried that I wouldn't want this thing to happen with her articulation also. So we stopped it for a week or so. And again, when she came, again, all those old velar sounds and all that we had worked was going wrong. So then we thought, okay, let's not completely stop working on articulation in spite of the stammer. So now we are having, the thing like, let's see, let's take it day by day, bit by bit. If she's in a mood, we work on her articulation. If she is not, then we leave it. So The current status is that her language skills are almost RLA is 4.5 to 5, ELA is 3.5 to 4. So articulation, we are continuing on all the sounds, but at sentence, so all these sounds are there, but it's more of at word level. And again, spontaneity is not still there. So we are working at sentence and conversation level. And later we'll work on the palatal and retroflex and affricate sounds. Fluency, we'll continue working on prolongation. And again, suprasegmentals we'll work because those variations are not very, you know, how we need. Still, going soft and then going very loud, or sometimes being a little monotonous, that's still there. So that is what we'll work on now. This is one of the recording, or rather the last recording. Can you hear it?
Not yet. I think the recording is yet to start. No, we can't hear anything. No, Meera, no, we can't hear it.
Okay. So do you suggest what can be done?
Now
No?
we could hear it. Yes, yes,
Okay.
yes.
So again, that loudness.
Okay, okay. Yes.
Where you want this?
The block.
New clinic. Whose clinic?
Yeah. So that's about it. Thank you. And
So if anybody,
yeah, please, any suggestions, any recommendations, welcome.
so I would like to, discuss a couple of things with you. So when you initially moved from one session a week to two sessions a week, that was the compliance, not, okay, fine, let's not put it as compliance. Was she eager to come to you that
Oh, yes.
I will play
Yes.
here?
Yes, yes.
Okay. And you are possibly, the third or the fourth speaker here to mention that it is much better to go with the Barakhadi instead of the English phonics any day. So it is much
Absolutely.
easier for on both sides actually.
It's so rich. It's so rich. It covers everything.
Yeah.
There's no chance of missing out on any, and then segregation becomes so easier.
Correct, correct. And also, like you said, you caught it like if there is who, you will not have lu. So you understand the co-articulatory movement that from, suppose after the her, you have the movement towards the, closing the vocal tract for the oo, but you don't have it after the glide. So you know that when we are checking for one sound, you know all the matras we are likely to check if it is the Barakhadi, which we will not do it in English.
True, true, absolutely.
Also, tell me something from the description that you just spoke about and you just discussed this. Tell me something. This child clearly has a lot of anxiety issues, right? Right from the selective method of speaking, then the social gathering, then improving at it, and then developing stuttering.
Correct. She does.
Okay.
So, which is again certain things what we had to discuss is in the first session, mother was like, you better be a little, don't be lenient. Those were
Yes.
her words, don't be lenient, because even in OT, she took a lot of time to adjust. And she literally, she'll do something wrong and purposely look at you, trying
Correct.
to get that reaction, which was so again, we had a very frank discussion with the mother that see, the child is behaving in a certain way. Okay, it's actually an avoidance behavior. She is
Correct.
not trying to make things difficult for us. It's just that there's something underlying which is bothering her and which is kind of making her act in this way. So just
Correct.
being strict is not going to work. Definitely not for speech, because speech is something that is kind of, it's coming from within. Still, OT and movement based things you can still do, and there's some fun element, along with it. But for speech, we are asking them to work on their complete weakness, which any human being will try to be away from.
Correct. Absolutely.
So we have to make her love it. We have to only inspire her to get engaged. First of all, whether verbal or not, just get involved, be okay with that, open to that, start enjoying interaction. Again, verbal or not, just enjoy that. And then we get into the process of working on language. So sometimes basically what I feel is we unnecessarily give a lot of, not unnecessarily, but we give undue greater advantage to thinking what the diagnosis is, what the strengths are,
Absolutely.
what the weaknesses are, or rather more on weaknesses. So,
Correct.
and for that mother also, I would say what the parent is doing, what the parent is not doing, but we don't know what they are going through, what the child
Absolutely.
is going through. So it's more important for us to understand the child, to understand the family, connect with them as a person. Once we do that, then things become easier. They also open up to work on their weaknesses better, and then we can, navigate things from there. But right from the beginning, if the focus majorly is on finding the faults, finding the negatives, or again fixating on finding the diagnosis or what
Correct.
parents are doing or not doing, I feel somewhere it's a little counterproductive. And the other
Absolutely.
approach is kind of more helpful, because we truly genuinely then get to be a bridge between the
Correct.
child and the family.
Correct. Meera, can you stop sharing your screen?
Yeah.
Then only we'll be there. So what happens is, she is going to grow up, and if she has good memories about this, she'll manage the stuttering as an adult. She's going to come back to you for help, and she's going to look at the whole thing like that. Otherwise, she's going to grow up and she's likely to have a lot of regrets in the way you went about it. Correct?
Absolutely.
So another strength that you used was her brother, like actually using her and then using him, sorry, through the session for as a role model, and then you phased him out when other things started.
Correct.
And like you're saying over here, there are like two instances. One is, how the brother was helping, and then he's landed up being counterproductive. And the second is how, despite having an older child, the mom was much more concerned about the articulation and not the language, despite having another kid whose development she has seen, she has been through.
That too,
So,
the language gap was a huge one. It was not
correct.
even just few months, it was a huge gap.
Yes. So while working, what did you think about her cognitive level, like understanding basic fear, consequences, working around a person? What do you think about her future independence and skills?
So the improvement has been significant. Whatever
Okay.
improvement was seen in language and articulation, immediately side by side, that much of improvement was seen in social skills, pragmatic
Okay.
use of metalinguistic skills, use of the learned language for, in general. Again, I make it a point always, you greet the child before you, and then after
Absolutely.
you're going. So again, you can see the differences. Again, mother gets a lot of videos. There are a lot of positive feedbacks from the school, her involvement with school
Hmm.
groups. Again, she being excited, getting friends in the house now. So,
Correct.
so those changes are now seen throughout in all aspects of her life.
So those are socially very significant, right? They are extremely important and significant. So one reason also could be this, the family dynamic that you were saying. They were almost going to, they were going to break up from a joint family to a nuclear family and go somewhere else. So I think that also would have definitely contributed to this
Correct.
issue.
Correct. Absolutely.
Because getting friends home is something like only if the family matter is sorted can you get somebody home. Otherwise, the
Yeah, it
mom
was
is
not
fighting
rather
on
home,
so
it
many.
was mother's clinic though.
Yeah,
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 yeah. So the mom is fighting on so many fronts. The mom herself also wants to work, then she has to protect the kids at home also. So
true, true. So that's what we don't know each one's struggle, what they are going through. Somewhere
Correct.
when we expect things from parents, we are just hellbound on our goals. But
Absolutely.
what they have their own journey, and
Yes.
it's as we have our goal, one particular goal, how well we can stick to it. In spite of all
Correct.
the things we are having in the, in our daily routines, we have
Correct.
to we have to take them as people and not as patients and patients' family.
Absolutely. Because see, the results you had, especially the social ones that you're discussing right now, you hadn't planned for them. They happened because of the improvement in attention, compliance, language, and definitely the family environment back at home. So those,
In general, I would put it as just enjoying people, enjoying
absolutely.
communication.
Yeah, so those are not our written goals. So those are not something we would stick to. Those just happened because you were flexible enough that, okay, fine, like, you know, we should pay attention. See, the moment she started stuttering, you had actually written that is the day I decided articulation exercises should stop, because that is a law that is demanding. You're taxing the child quite a bit by saying, okay, can we try this? Can we try this
And
sound?
in her case, most of the sounds. So,
Yeah,
so
exactly.
every now and then, the minute she opens her mouth and says something, there has to be some correction. There has to be some
Be some
correction.
correction. Absolutely, absolutely. No, no. Overall, I mean, you have put it forth wonderfully. Like you put out so many activities and methods that you actually went about it, and how you made those clinical decisions from once a week to twice a week with the parent, with the brother, without the brother, and things like that. Your flow was like excellent, and it shows us so much. Like, see, if this kid had come to you at 6 directly with stuttering, you would have had so much digging to do to understand कि अरे ये तो speech delay, language delay बच्चा था to start with, and now you have come to me with stuttering, and you actually saw something else completely evolve out of just an articulation problem. The mom came with a articulation problem, and see where it took us.
Again, I tell you in this case, for me personally as a clinician, there was a lot of dilemma. So articulation, phonology,
Ah,
praxia. So, but I was like, I don't want to get into this dilemma of,
correct.
diagnosis. Let that be aside.
Absolutely. Because the more we do that, what happens is whenever we are thinking, we put it on the parent also, na, अरे ये भी है, ये
Absolutely.
भी है, ये
Even
भी
on
है.
the
Correct.
child, because subconsciously we say, but while we
Correct.
are taking therapy, it comes across.
Absolutely, absolutely. Because it's there in your goal. You are thinking about it. Ki, Arey, because of all this today, Arey, ye chhoot gaya. And see, you're telling that because of the foot issue, she did have a lot of OT earlier. But definitely the regulation was not taken into account, because the regulation had a lot of social anxiety and separation anxiety component to it.
Which in fact, what mother did was, I think 6 months back, she stopped OT and she
Okay,
made her join some functional training wherein just play with the ball. The name of
okay,
the thing only, the classes is ball something, ball ghatkopar or something like that. So
okay.
wherein they do all activities with different kinds of balls. The child started enjoying that so thoroughly, and mother
Haan,
was like, that was another good decision which I had taken to stop OT now. Well, she'd been in OT for quite a while. Like then
correct.
it's like now it's a plateau there. So then she shifted
Haan.
her to this thing, and she was again enjoying that also.
Correct. Yes, because that is functional. From the leg issue that you told me, that you discussed, it is more of the strength or that issue which was looked into. The regulation issue was definitely not looked into, and obviously the anxiety piled on the child. The separation, the social, the family issues, the anxiety just piled on the child. So you can see the avoidance behaviors. What we see are always the manifestations of something much deeper, basically.
Another thing is not taking things personally. That also is a huge one. For the child, for the parent or for the clinician, the child is
Correct.
not behaving like that to make things difficult for us, but it's that
Absolutely.
something dysregulations are within them which is manifesting.
Absolutely. And we have so much to work at. So if we are like, Arey, being strict is not how you go about it, that is not going to get you far. It will
True.
get you results. Okay, so I don't see anything more in the chat, basically. So
Any suggestions, people?
so I think I mean in the Western Zone in Mumbai, everybody knows you. So if there is suggestion, I think people will get to
Yeah, yeah.
So, Meera, this is something very small, but as a token of love and appreciation for accepting and choosing to discuss your personal case, your story, how you went about it, and everything.
Thank you so much.
And so, I think we can wind up here. Thank you for keeping it so nice, short, and crisp, like to the point. And the way you went about it, your flow was too fun. It was very nice how you managed to keep it for us to not see the kid, but to understand the entirety.
Correct. No, it was fun for me too.
Good. That's what I'm looking out for. Okay.
Okay.
So I think even everybody's looking forward to winding this up, getting to their dinner and their
Dinner
feed.
time.
Yes. So thank you everyone for joining in on a weekday evening after your work. Thank you for the community support. Thank you for always showing up. So if you have anything more, do communicate. If it's about the case with her, if any of you want to present, please do communicate. It is just a matter of fixing up and then sharing our stories. So thank you, Meera. And
Chalo.
good night. Good night,
Bye.
everyone. See you. Yeah, yeah. Bye. Bye.